Eileen Veilleux, the fam here. Welcome to another installment in our mini mental health series. In today's installment, we will be learning about tardive dyskinesia. Before we begin, let me remind you to please watch the full video because throughout the video there will be 3 key words. At the end of the video, in the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So, let's get started on what is tardive dyskinesia. Well, tardive dyskinesia is a keyword side effect of antipsychotic medications. These drugs are used to treat schizophrenia and other mental health disorders. TD causes stiff, jerky movements of your face and body that you can't control. You might blink your eyes, stick out your tongue, or wave your arms without meaning to do so. Not everyone who takes an antipsychotic drug will get it, though. But if it happens, it's sometimes permanent. So if you have movements you can't control, let your doctor know right away. To ease your symptoms, your doctor may lower your medication dose, add another medication to what you're taking to act as an antidote, or switch you to a different drug. Now, some of the symptoms of tardive dyskinesia, better known as TD, is stiff, jerky movements that you can't control, which would be orofacial or broncholingual dyskinesia, which is uncontrolled movements in your face, namely your lips, jaw, or tongue. If you have orofacial dyskinesia or broncholingual dyskinesia, you might stick out your tongue without trying, blink your eyes fast, chew, smack or pucker your lips, puff out your cheeks, frown, or grunt. Now, you may also get what they call dyspnea of the limbs, which affects your arms, legs, fingers, and toes. And what this will cause you to do if you have the dyspnea of the limbs is it will cause you to wiggle your fingers, tap your feet, flap your arms, thrust out your pelvis, or sway side to side. These movements can be fast or slow. You may find it hard to work and stay active. So what are the causes and risk factors of this? Well, antipsychotic medications treat schizophrenia, bipolar disorder, and other brain conditions. Doctors also call them neuroleptic drugs. They block a brain chemical called dopamine. It helps cells talk to each other and makes the muscles move slowly. When you have too little of it, your movements can become jerky and out of control. You can get TD if you take keyword antipsychotic drug. Usually you have to be on it for 3 months or more, but there have been rare cases of it after a single dose of an antipsychotic medication. Older versions of these drugs are more likely to cause this problem than the newer ones. Some studies even find a similar risk from both types, though. Antipsychotic medications that can cause TD will include antipsychotics like Haldol, fluphenazine, Risperdal, and Zyprexa. Your chances of getting TD go up the longer you take the antipsychotic medication. Some drugs that treat nausea, reflux, and other stomach problems can also cause TD if you take them for more than 3 months. These medications may include Reglan, Compazine, and you're more likely to get it if you are a woman who has gone through menopause, over 55, you abuse alcohol or drugs, or you're African American or Asian American. So, how do they diagnose this TD? Well, TD can be hard to diagnose. Symptoms may not appear until months or years after you start taking antipsychotic medication, or you might first notice the movements after you've already stopped taking the drug. The timing can make it hard to know whether the medicine caused your symptoms or not. So, abnormal involuntary movement scale, better known as AIMS. If you take the medicine for mental health conditions, your doctor should check you at least once a year to make sure you don't have TD. He can give you a physical exam called the Abnormal Involuntarily Movement Scale, which is, like I said, known as AIMS, which will help him rate the abnormal movements. He can also do tests to find out whether or not you have another disorder that may be causing these abnormal movements, like cerebral palsy, Huntington's disease, Parkinson's disease, stroke, or Tourette syndrome, to name a few. To rule out these conditions, you may get blood tests, imaging scans of the brain, such as a CT or an MRI. So, if one person has TD, how is it treated and prevented? Well, the goal to prevent TD is to prevent TD. When your doctor prescribes a new drug to treat a mental health disorder, ask about its side effects. The benefits of the drug should outweigh the risk at all times. If you have keyword movement problems, tell your doctor, but don't stop taking the drug on your own. Your doctor can take you off the medicine that causes the movements or lower the dose. You might need to switch to a newer antipsychotic drug that may be less likely to cause TD. There are a few FDA approved medicines to treat TD. One of them is Austedo, and the other one is Ingrezza. Both of these medications work in similar ways to regulate the amount of dopamine flow in the brain that controls certain kinds of movements. Both can sometimes cause drowsiness. Austedo also has been shown to sometimes cause depression when used in patients with Huntington's disease. Although there is no proof that natural remedies can treat it, but some might help with movement. So that's what TD is, and as you can see in this illustrations, they show a couple of them. You can see like movements like this. The second one, puckering your lips, your eyes scrolling up and you looking up, and you sticking your tongue out, just opening your mouth, a slight tongue, sticking your tongue out, puffing your cheek out. Looking like there's just so many, and these are just the oral facial things that can go on. Like it says, it can do triggers with you moving your fingers or your arms. Now we're going to go back to looking at me so that here we go, can talk to you. So as you're just seeing, those are just some of the oral facial expressions that can happen with TD. But as I mentioned, it can also affect your arms and legs. I hope you all learn a lot from these because there's a lot of different things out there that we don't know. Now, some of these mental disorders, like TD, you can see. But it can be confusing because people with Tourette's can have it. And there's different things that people can have different tics. I once had a friend, I lost contact with him, but he had a tic of his neck going like this once in a while and jerking. Other than that tic, he was perfectly fine. Um, You can't judge a book by the cover. You need to know that. You need to remember to look from here, from the heart. Because if you go by what your eyes see, they can deceive you. You could see somebody that looks perfectly normal from the outside, but they could have a number of physical disabilities going on. They could be legally blind. They could be deaf. They may not. They may be what they call deaf and mute, where they can't speak. Just to name a few medical disabilities, that affects the physical. Or they could have inner ones like different mental disabilities or fibromyalgia or Crohn's or anything like this. We don't know. You can't tell this just by looking at somebody. You need to get inside, and you can only do that by seeing with your heart. Because your heart goes beyond the skin. It sees that person for who they are inside. And that's what really matters. Because even all the models through the ages, they're glamorous and they're beautiful. But what happens as they get older? They get replaced with younger models. And their career and everything is now down the tube. Because outside beauty it fades away. But the inner beauty of a person is infinite. It stays forever. And that's how we need to learn to see people, is from within. Not from here, but from the heart. I hope these little mental health series help you understand and truly help you to see people from the heart instead of from the eyes. Because once we all start to learn to see from the heart, this world can be a better place. Especially right now with everything going on with the COVID virus. I mean, we need to be there for each other. It's not just beneficial for the other person. When you uplift, encourage, and inspire somebody, you release endorphins inside your body. Now, if you don't know what endorphins do, endorphins help heal you on the inside. They help heal you physically, mentally, spiritually, and emotionally. Now, on the other hand, because everything has two sides, even a coin has heads and tails. If you are what people would call a downer, or you're mean, you're going to always feel sick. You're going to have the opposite effect that the endorphins have. The endorphins help you stay healthy. Well, if you're a negative person, you're not going to be releasing them endorphins. You're going to be releasing toxic stuff into your own self, which is going to cause you to be sick a lot. You're going to feel down. Your life is going to feel miserable. So if you're starting to have a down day, just for the heck of it, try being nice to somebody, just out of the blue. Say hello to a stranger. Just be nice and see if that makes you feel better. I can guarantee you it will. Now, when we do, we're not going to be 100% right away, because life throws personal stresses at us as well. And I do realize that. But by you releasing the endorphins inside your body, by inspiring, uplifting, and encouraging people, that helps lessen the negativity just a little bit at least that you're going through. Because remember, there's always somebody out there suffering more than you, physically, mentally, emotionally, and spiritually. There's people out there that have no one. They don't have any type of backup system. They're truly alone. And to them, that must be so overwhelming to feel like you're out alone and there's nobody to talk to, nobody to vent to help release some of your feelings. So always, always see from your heart and not with your eyes. And until I see you next time, remember, you are all beautiful on the inside if you choose to be. We choose how we are. We mold ourselves. Society doesn't mold us. Other people don't mold us. Our parents don't mold us. You are in control of your own self. And what I mean by that is you can choose to be negative or positive, happy or sad. And it's not always about the storm that we're going through. It's how we handle the outcome of the storm. And a lot of times I think that if we handle the storms differently instead of, oh my God, I'm in a storm. I'm going through all this, like what I'm going through right now. Okay? I've been away. It hasn't changed me. I just had to pause my YouTube channel for a while so I could take care of this. But I didn't let this storm make me bitter. I don't want anything that I go through in life to turn me bitter, angry, resentful, or anything negative. We need to look for the positive in every situation because a lot of them have been put in our past to make us stronger. And I have learned a lot. I made some mistakes with this that I should have known better, and I probably wouldn't have been in this fix. But, no one's perfect. But now it's time for me to get back on track and help others. I got the main part of my problems taken care of. We're still working on it. But now I need to go on with my life and not let that consume me. It's okay for us to have problems, but it's not okay for problems to have us. And what I mean by that, it's okay to have everyday problems. We all do. It's part of life. But we don't need to let them consume us. And a lot of times, we don't realize it, but we can tell when we reach out to others, whether it's through YouTube, Twitter, Google Hangout, Zoom, or whatever, that helps us keep in touch and stay grounded. Because with everything going on in life, it's so hard to lose focus and not know where we're going, and therefore we're not grounded anymore. Remember, I love you for who you are in here. I don't care if you're tall, you're short, you're thin, you're fat, you have a mental disability, a physical disability, or no disability. I love you for who you are in here, inside. And that's what counts. So remember that. I love each and every one of you. Yes, you, I'm talking to you. I'm looking right at you. I see you out there. Hi! I'm talking to you. I love each and every one of you for who you are because you are all beautiful and special people in here. So until I see you again, you have an awesome day and try to keep smiling and try to stay grounded. Bye.